Okay, aloha everyone. We are going to call this meeting to order and welcome everyone to this joint informational briefing between the Hawaii State Legislature's Senate Health Committee and House Pandemic and Disaster Preparedness Committees. This Zoom meeting, including the audio and video of remote participants, is being streamed live on YouTube. You will find links to viewing options for all official proceedings of the legislature on the live and on-demand video page of the legislature's website at www.capitol.hawaii.gov. I am Senator Jarrett Keohokalole, Chair of the Senate Health Committee. I am joined by my Vice Chair, Senator Roz Baker, Senator Sharon Moriwaki, Senator Kurt Favela, and we also have Senator Joy San Buenaventura on the Senate Health Committee. We are joined by our colleagues from the House. Chair Ichiyama, would you like to introduce your members?
Thank you very much, Chair Keohokalole, and also for allowing us to join you today. Aloha, everyone. My name is Linda Ichiyama, Chair of the House Committee on Pandemic and Disaster Preparedness. Today, we are joined by Vice Chair Rep. Stacey Lynn Eli, as well as Representative Tina Wildberger and Representative Kyle Yamashita. Thank you.
Great. So today's Friday, February 26th, 1 p.m. agenda is our third joint briefing regarding the Department of Health COVID-19 vaccination plan. And today we will hear from the Department of Health Director, Dr. Libby Char, an update on the Department of Health vaccine plan, including an update on distribution, eligibility of vaccine, and several issues that we are preparing to address going forward. Members, as we have done in the past, there is time reserved at the end of their presentation for question and answer. And as we have done before, we're going to take turns between the respective chambers. So if you do have a question to ask, we'd ask that you queue yourself up in the chat so that we can take everybody in order. With that said, I also would like to thank the House for coordinating with us to do this joint briefing. I think it has been very helpful for the members and for the public. So thank you for that, Chair Ichiyama. And with that said, Dr. Char, thank you very much also for being with us. The floor is yours.
Thank you. Thank you, Chair Keohokalole and Chair Ichiyama. The Department of Health just wanted to provide a bit of an update on the vaccination status for our state. So if I could have the next slide, please. And next one. So we've spoken about this before that in the state of Hawaii, we're getting vaccine out to people in 4 different ways, and now there's 5 different ways. So as we mentioned before, the large long-term care facilities, we have a program with the federal government, CVS and Walgreens, and they go into the care homes and they vaccinate the residents and the staff. And then we have agreements that we have set up in Hawaii with some of the small independent pharmacies. And through that partnership, they're going to the smaller long-term care facilities like the community care homes, the disability, developmental disability homes, and some of the residential community care homes, and they're vaccinating people there. Third is the federally qualified health centers. And those are really, really important for us because their patients and their communities are some of the hardest to reach, either for geographic reasons or for cultural reasons, language barriers, and they are part of those communities. And so they're much more successful, I think, at getting vaccine to those people in their areas and to their patient population. So very appreciative that they're helping with the effort. And then you've heard of the pods before. That's what most of the public is familiar with, the points of dispensing. We consider the pods things like the hospitals that are dispensing vaccine at their hospital sites, as well as some of the public pods, like you've heard of the one at Pier 2 being run in partnership with Hawaii Pacific Health, the one that's at Blaisdell being run in partnership with Queens Medical Center. And there are other pods around town. Windward has one, Leeward Community College, and some of those. What you see in the upper right-hand corner is the Federal Retail Pharmacy Program, and that's a brand new program that will become more and more prominent, and we'll get to that in a little bit. If I could have the next slide, please. So this just kind of shows where we're at right now. If you go to the Hawaii COVID-19 website, we have some graphics and whatnot that are up, and on the disease outbreak and control, there's also some other graphics and some other data there. But what this is showing us is just tracking the various counties and the vaccine that has been administered. It's tough right now. We're separating out. The reason we're not calling it just first dose and second dose is because now with the advent of Johnson & Johnson, it's going to be a single dose. So if you say at least one dose, you can see through the colors on the graph, the population that's gotten that. Look at the numbers underneath that, the 22,000 people on Kauai, the 213,000 people for Oahu, the 25,793 people in Maui County, and the 35,926 people on the Big Island. Because the percentages can be a little bit misleading when you have smaller populations. So look at those overall numbers. And then the darker number underneath that is everybody who's gotten at, sorry, that's the people that have gotten the second dose as well. So the vaccines we're using right now, the Moderna and the Pfizer, all require 2 doses. Next slide, please. So this is just another graphic depicting that. And you can see at the top at 81%. So from the time that we have received the vaccine in the state of Hawaii, 81% of those doses are administered within a week. And I think we're doing a pretty good job of getting it out there. When we compare ourselves with some of the other states, we're doing fairly well, and we've been doing pretty consistently well with getting the vaccine into people. I know early on there were some concerns about vaccine, being held in freezers and whatnot, and that was never the case. For the most part, the vaccine is ordered and it goes directly to the hospital or directly to the clinics. And so it doesn't even come to the Department of Health. It goes directly there and they're able to get it out quickly. The other thing that's helped us a lot is that in the past few weeks, we're now getting a little bit of a glimpse into what our allocation should be for the next 3 weeks. That's helped us a lot because before we could never plan. We weren't ever sure how much vaccine we were going to get the following week. And so we didn't want to make appointments and then not be able to meet them. We've gotten assurances at this point that when we receive an allocation, that in the following weeks, we will receive at least that much. And so that's been really, really helpful for us to be able to plan ahead. We're not seeing gigantic spikes in how much we're receiving, but it is definitely trending up. So whereas we had been getting about 35,000 doses and we saw that climb to 40,000, and right now we're getting about 50,000 doses per week. Next slide, please. So this is where we are with regards to the kupuna. The 60% of eligible population looks low, but there are so many different ways that the vaccine is being administered. And some of it that first one we talked about was through the federal program with long-term care facilities and CVS Walgreens. And so some of the data is really hard for us to capture because what they do is they put aggregate data online in some of the federal websites. And without getting the line item feeds, it makes it really challenging for us to sort out, the 75 and older for some of those populations. But we at least know for our data and for the doses we administer where we're at. And so the other issue is that, if you think about it, the long-term care facilities are likely to have a lot of older people there. And so I think it's kind of skews it artificially low when we're counting our doses. I think a lot more than 60% have been vaccinated because those are people in the care homes and whatnot. Next slide, please. So this is kind of the history of where we've been. So we started out in phase 1A with our healthcare personnel and our long-term care facility residents. We got a good handle on that. We know the programs are working. We're getting vaccine to people. And even as we do that, once we knew that that was on pretty solid footing, then we started adding in some of the phase 1B, 75 and older. So even though we still have a little bit more vaccine to administer in the long-term care facilities, we're not waiting and sitting in one spot until every last person is done to progress to the next level. And so we went from 1A to 1B, And now we're kind of doing the same thing with the 1B. We're finishing up 1A, but we're in 1B. We're doing 75 and older. We've been doing, I think the first responders are just about done. Frontline essential workers, we've gotten a good handle on it. And these are large groups of people, but I think it's going well and we're making good progress through it. Some of the confusion comes from, it's been kind of challenging for us to message about the 1B, and people keep asking, well, who's in it and what order are you going in? If you see on the right-hand side of your screen, that's kind of the definition that we're working under for the 1B, and those are frontline essential workers. So I would call your attention to it being frontline, and also that it's essential workers, kind of critical infrastructure. It's people who can't telework. It's people who are working within 6 feet of others, who are in contact with people, either their coworkers or the public, and it's just by nature of what they do and the environment that they're in. And we've tried to list kind of general categories of people, but it's really tough because, I mean, even if we were to list 100 occupations, there would be 100 more that could probably fit in there. And then trying to make the distinction between industry versus the occupation, that's also a bit challenging. So I understand there's frustration on, us not having a specific list with everybody's job title in there, but it's really, really challenging to do that. So this is essentially what we're going by. 1B, frontline essential workers, within 6 feet of each other, critical infrastructure, it's essential function to society. Next slide, please. So this is how we tried to break down that 1B. You can see on the far left, it's about 230,000 people. So that's an awful lot of people. And that's why we didn't want to just say everybody in 1B, go for it, because I thought it would be incredibly chaotic to have that many people trying to book appointments all at once. We wanted to make sure that both channels were able to access vaccine. And when I say both channels, I mean, on the one hand, we're looking at reducing morbidity and mortality. So that's for the individuals. The kupuna, we know that they have significantly higher risk of getting sick and getting seriously sick. And at the same time, not just focusing on that, but also focusing on the essential workers. And I think people had a mistaken belief that it should just be all one or the other. And I think in order for our society to function, we needed to make sure that the critical infrastructure was being protected and vaccinated, as well as those who are most at risk. And that's why they're going simultaneously. We've managed to get through a significant amount of the 1B essential workers and get people protected. We started out with first responders, and we've been working really hard trying to get our educators vaccinated to protect them. A lot of critical infrastructure workers, having to do with core resources like power and gas and water and things like that. And then just other essential functions that we needed to keep operations and government running. We're transitioning now to include agriculture and food production, as well as distribution and some of the other essential workers. Next slide, please. So these are some of the challenges that we've had recently. And I think we've actually done pretty well in dealing with them. So federal supply shortages, that was just a nationwide issue with the amount of vaccine that was being produced that could be shared amongst all the states, territories, and tribal nations. And so I think, we've been lucky that we've gotten a pretty reasonable amount of vaccine. We wish it was more. We can obviously handle more, but I think we've gotten a good dose, and we've been able to get those doses out. The weather-related delays, that was all from last week when they had the terrible ice storms across the nation. Good reminder that, we're really fortunate to be living in Hawaii, and that we didn't physically have to deal with that, but we were affected by it because they couldn't ship any of the vaccine. And so the entire allotment from last week of Moderna never made it to our shores. For the electronic reporting, that has to do with the system called VAMS, and that's from the CDC. And they mandate that any of the doses that are administered get reported in VAMS. And that's been real challenging for some of our providers to be trained in it, and then to be able to use it and then to enter the data in a timely fashion. So we have had some delays there. We have people dedicated from the Department of Health working on VAMS and as a VAMS representative. So when we notice that we run report cards for some of the hospitals and whatnot, and we notice that if there's a significant discrepancy between the amount of vaccine they've received and what we're seeing in VAMS, then we link up to make sure if it's a problem with them getting the data into VAMS, then we're trying to help them to make sure that they're able to do that. And then the decentralized registration, that's just been issues for us. What that refers to is that the various hospital systems that have been helping to administer vaccine have their own registration systems or portals or whatever. And so that's just been challenging for us because obviously we don't have like a central control over it. And there's been conversation on both sides, like should we have something that's just central and just say everybody who wants to administer vaccine must use this one system? Or would that be very problematic for some of the partners that have been administering vaccine thus far? Next slide, please. So this just shows how much vaccine we've received each week. And you can see in the beginning, it was kind of up and down. We weren't really sure what we were going to get the following week. So in the second week, we got the 28,575 doses. And then the following week, it dropped. And then it started climbing again. And then the week of January 10th, we got a huge amount of vaccine. And then it dropped by, over 20,000 doses the following week. And it was just sort of really challenging for us to be able to plan ahead. Since January 1st, we've started on a more steady march with vaccine steadily going up. And the new administration has promised that whatever we receive one week, we will receive at least that much the following week. And that's been very stabilizing for us. That February 14th that you see that's really low is the weather delays. And so obviously we only got the Pfizer. And then the week of the 21st, this week, we did get all of our allocation of Moderna, some of it arriving as recently as yesterday, but sorry, not yesterday, Monday. And then what we had ordered for this week came in. So as of yesterday, we have everything that we've ordered and we're completely up to par. Next slide, please. Can I get the next slide, please? So we're talking now, I think we had mentioned on Monday, Chair, that we have eyes on trying to get vaccine to those who are 70 and older. And right now we're still in 1B, and that calls for vaccinating 75 and older. We're not ready to go to 1C yet because we still have a lot of essential workers and so some kupuna in 1B that we need to vaccinate. So the question for us is, do we just sit in 1B or do we C? And again, moving to 1C, it is a gigantic category. There are about 500,000 people in 1C. And we thought that if we made that move now, it would just be utter chaos with people trying to, compete with each other to get vaccine. That being said, we don't want to sit and wait if we have appointments that can be used. And so, working it out and discussing it with the leadership, we thought it was very reasonable to start offering vaccine to those 70 and up as soon as we get through some of the backlog and the weather delays and whatnot. So we have eyes on offering vaccine to 70 and up. That's probably going to be within a few weeks. And I can't give you an exact date right now because it depends on getting the vaccine from the weather delays, rescheduling all those appointments. Thousands of appointments were canceled, so we need to reschedule those. And then there's a huge amount of second doses that need to be given next week. So if we get through that, we'll have a much better picture on when I can give you a date after that about starting to vaccinate from 70 and up. But I think, that's going to do well for our community. People are anxious to get the vaccine. We don't want to have appointments that are not being snatched up. We want it to be moving really quickly. We want people to be signing up. We want the appointments to get filled really quickly. So you can see in 1A, definitely in progress there. We've been in 1B for several weeks now, and I think we're doing well with that. And I think we can welcome 70 and older shortly. We're very, very excited about being able to expand the population that is eligible to receive vaccine. And I think depending on the uptake of those 70 and older, we've got eyes already. We're starting to plan on setting things up to open it to phase 1C. Can I get the next slide, please? So I don't know if Dr. Campbell is on the line.
Hi, yes.
Thank you. Can you help us with this?
So just to talk a little bit about the rationale for prioritization in reverse age order, this is a chart showing outcomes from COVID-19 according to age group. And it's pretty dramatic decade by decade to see how death is correlated with older age. And this 80+ year group in particular has borne the greatest burden of those deaths. And even each decade in reverse from there, we see that sort of dose response relationship between how old you are and your risk of death. That's part of why it's been so important to emphasize starting with the oldest age groups and getting as far through those categories as we can, and then adding on the next age group after that to move through these folks that are at highest risk. Next slide, please. A similar story for hospitalization. These are raw numbers, not rates. And so some of this is determined also by how many people we have in our population in that age group. But the combined outcomes of hospitalization and death in that 80+ age group is over 50% have outcomes of either hospitalization or death. So just again, showing the severity of outcomes. Next slide, please. So a 75-year-old is 8 times more likely to be hospitalized with COVID-19 than a 20 to 24-year-old, and 186 times more likely to die of COVID-19 than a 20 to 24-year-old. So the moral of this story is just understanding why we place such a high priority on these older age groups, and to please ask for the patience of those in the younger categories. We do want everyone to be vaccinated who wants to be, and that helps reduce transmission overall. But the first goal here is preserving life, and getting these older folks vaccinated first helps us to preserve life. Thank you. Next slide.
Can you get the next slide, please? So this is a pictorial of phase 1C that we mentioned and why we're being very tailored and strategic in our rollout. If we just opened it all of a sudden and said phase 1C, that would be about 500,000 people, actually a little bit over 500,000 people. So there are 3 categories that fall under phase 1C. Those who are 65 and older, and there are about 114,000 people according to our census reports. The next group is those with comorbidities or serious health issues that would put them at risk for severe illness if they were to get COVID. And that is a huge category. So those are, diabetes, hypertension, all the way up to people who have had organ transplants. And that is about 345,000 people. And then other essential workers that were not recommended as, the frontline essential workers, and that would be another 80,000 people. So the good news is that as we get more and more doses and we open more venues, that will allow us to be less prescriptive in the assignments of who's eligible to, at that point go and get vaccinated. So I think we're sort of picking up speed and we're getting some steam, and we'll be able to get people vaccinated faster the more vaccine we're receiving in our community. Can you get the next slide, please? And one more. So the Johnson & Johnson vaccine actually was recommended today. The vote just went down about an hour and a half ago, that the Vaccine and Related Biologic Products Advisory Committee, that's a mouthful. This is a committee that reviews the data and the studies, and then they make a recommendation to the FDA. And the vote was 22 in favor and 0 opposed to make a recommendation to the FDA that the Johnson & Johnson vaccine be granted an EUA. So now the FDA will also have to review and see if they concur. But it's expected that within the a matter of days that the FDA will concur and allow an EUA, emergency use authorization for the Johnson & Johnson vaccine. So we're very happy about that. The other good thing is that that's going to mean a third vaccine for us. So for whatever amounts we're getting for the Pfizer and the Moderna, now we have another vaccine, and that's just going to add to it. That's exciting as well. There is a small amount of vaccine that's been produced that we're told the federal government will roll out as soon as all this happens and goes through and we can get it, maybe even within a week or so. But it's going to be very sporadic at first, and it won't be that much. And they said there's not a big stockpile, so the week after that we'll probably get nothing, and then thereafter they'll slowly start ramping up what they're delivering to us as the production ramps up. I think the message with Johnson & Johnson, I know there's been a lot of questions about, oh, this is this as good as the other ones? And I just want to say that there are some very important key distinctions about this vaccine, and some that are actually not distinct at all. Number one is it's much easier for storage and handling. It does not require that -70-degree freezer. And so that's huge for communities. If you can just store this in a regular refrigerator, that's going to make it accessible to a lot more people. The second thing is that the Johnson & Johnson, the EUA that went through, is for a single shot. So whereas the other ones, you have to get a shot and then get a second shot 3 or 4 weeks later to be fully vaccinated, with the Johnson & Johnson right now, it's just that one shot. And then the third thing is, really when we look at the vaccines and what we need them to do, the goal is that they prevent serious illness and hospitalization and death. And the Johnson & Johnson vaccine has shown to be very effective at doing exactly that. It prevents serious illness, it prevents hospitalization, and it prevents death, and as do Moderna and Pfizer. And that's the real takeaway from this, is that this vaccine is safe and it does what we need it to do. We will make it voluntary, just as we do with all vaccine. Nobody is forced to receive it. But I think it's going to be a great option for some people. And it also makes sense that if we're in a situation where it's really challenging to get that, schedule that second appointment for follow-up and get the person to come back on the scheduled time and make the appointments and all, this may be a really good option to be effective. Next slide, please.
Hi, everyone. Hi, chairs. Kathy Ross, Deputy Director. So I'm covering just very high level the FEMA Public Assistance Package that Department of Health was awarded. So the nice thing, unlike other FEMA awards, this actually covers 100% of eligible expenses. Usually there's a state share involved in this, like a 75-25 or 80-20 split. And so we're really, really pleased that this administration has decided that vaccinating our residents is a very important thing to do, and they're going to fund it at 100%. So the current package that Department of Health is approved for is just under $175 million. And again, the nice thing is 100% covered. So we will have to front money. We will need to use our general funds to be able to pay for the upfront expenses. However, 87.4 million of that 174.9 million is very easily accessible for us to get reimbursement. So we're not having to carry this big expenditure on state general funds for a long period of time, as normally is expected with FEMA reimbursement processes. This 87.4 million becomes reimbursable to us in a very short period of time. And I don't want to say exactly how short, because you never know how quickly it actually happens, but we have been promised that this initial 87.4 will be able to help us cover our expenses right away, so that it's not such a big burden on the state general fund. We are working with some of our existing vaccination partners to reconfigure those agreements that we have with them so that it maximizes these federal funds first and foremost. At last resort, we want to have our state general funds carry the burden of paying for vaccination activities. So with our vaccination partners and also with our in-house vaccination activities, we are going to first utilize this FEMA public assistance to pay for those expenses. We, as you guys might know, we also have 2 cooperative agreements in the Department of Health from the Centers for Disease Control. So that will be our second line of defense for paying for vaccination efforts. And again, at very last resort, we'll be using general funds to pay for vaccination activities. Thank you.
Thanks, Kathy. Next slide, please. So just to wrap it up, there's a new program that came online from the federal government called the Federal Retail Pharmacy Program. This was an initiative by the federal government, and it's a program that's starting small and should be ramping up over time. What it is they selected one pharmacy group in each state, and in some places more than one, but in Hawaii, they selected CVS or Longs, and 6 stores were selected across the state to provide vaccination for the public. And right now it's limited to kupuna 75 and older, and you have to make an appointment. There don't want any walk-ins, but you make the appointment, and then those 75 and older can go to these various Longs that are participating and get vaccinated. The reason this is such an important program is that over time, they will add more pharmacies and they will add more doses. And so eventually it will blanket our state, and it will be right in people's communities. They won't have to travel a far distance to get it. And they can get vaccinated close to home in a place they're familiar with. And this program should parallel what the Department of Health is trying to do in terms of which populations are eligible to get vaccinated. So it started on, I think it was February 12th, I want to say a couple weeks ago. And it was roughly 750 doses to each of 6 different Longs drugstores. I think it was Kapa'a on Kauai, Hilo on the Big Island, Kahului in Maui, and then on Oahu, it was Manoa Longs, Kaneohe Longs, and Aiea. And then we just got word that 25th, so yesterday, they're adding 4 more stores. And each of those stores is also going to be receiving almost 1,000 doses of vaccine. And that's going to be in Ewa Beach, Iwalei, Aina Haina, and one in Kailua Kona. And so as we keep expanding this and we get more and more stores online and receiving vaccine, and this is vaccine above and beyond what we're being allocated. So this is just additional doses. And so that's that's a great bonus for us. But it's going to be in more and more stores, more accessible, more vaccine. And so I think it's going to sort of, the need for the pods will go down a little bit, and these stores will have it and will just go up, and people can just go and get vaccinated, similar to how you get your flu shot in many places. I think the next slide has a picture of the different pharmacies. So these are the initial 6 that you can see that there was 1 in each county at least, and then a couple on Oahu. And then the next slide is the last slide, and it just shows the 4 additional in Ewa Beach, Iwalei, Aina Haina, and Kailua Kona. And so that's what we had prepared for you today. I hope that's helpful, and we're happy to take any questions.
Dr. Char and staff of the department, thank you very much for that presentation and update. So we're ready at this point to take questions. I don't see any questions queued up in the chat. So Senator Baker raised her hand first. I'm talking. Senate gets to go first. Senator Baker, please.
Sorry, I haven't figured out how to use my chat function. But I have 3 questions. I think they're relatively short. I'll just run through them, and if you want to cut me off, that's okay. Can you break out Maui County by island?
Yes, so we have the data that's broken out by island. I'm sorry, I don't have that off the top of my head.
Maybe, yeah, if you could just send it.
Okay. Okay. We know how much vaccine was sent to each of those islands, and we know how much vaccine was administered in each of those islands, and the percentages. I'll be happy to send that to you.
Okay, thank you. Do you know how long it takes to produce a vaccine? To give us a sense of, how long it's going to take if they're trying to replace the doses that have been used?
I don't know. I don't know if Dr. Campbell might have a better guess than I do. I thought you meant like to develop it as like the fastest one has been 4 years, and this is a record breaking. But Sarah, do you?
But after you get them, after you've produced the first, how long will it take to get others produced? I'm just trying to get a sense of what it might look like, how long it's going to take to get the best possible herd immunity that we can by ruling these out. And then the final question that I have is, I'm assuming that we are still trying to get people to take the regular flu vaccine. And is there any conflict between if you take COVID but you don't take flu, if you take flu and you don't take COVID, is there any overlapping protection?
Get them both. I'm going to let Dr. Campbell give you the specifics, but get them both.
Yeah, we want everyone to get both vaccines. The current recommendation is avoid having the 2 vaccines within 14 days of each other, but you can get either one first and then the other, or vice versa. And that's going to give you the best protection against both.
Okay, thank you, Chair.
As far as the physical manufacturing of the vaccine, I don't know, Sarah, if you have any specifics on it, but I think some of it, my sense of it, and this is completely unsophisticated, but it's kind of like cooking something. So you need to get the raw resources first. And I think that's been part of the challenge. And that's where the federal government has stepped up to say that they will make sure that those ingredients that they need are accessible and that they can purchase it. And then the process to go on and manufacture. So I think that's where we're in a good place, because I think having eyes on, what the ingredients are that you need, and the federal government saying that they're going to help to make sure that we can get those. Sarah, I don't know if you have anything more sophisticated than that.
We really are relying on what the feds can tell us about where they're at with manufacturing. So we share that information as we hear it. And what Dr. Chard described earlier is what we know right now, that we'll get an initial number of doses. It won't be a very large one. They do plan to be ramping up over the next month, but it may be a little bit of a slow start.
Okay, thank you, Chair. Thank you for your answers.
We'll yield to the House, followed by Senator Favela.
Thank you very much. I'll turn it over to Rep. Wildberger.
Oh, thank you all so much. I appreciate chairs and director and DOH staff for being here today. The biggest concern I have is that Maui's numbers are lagging so far behind the other counties, and my community really wants more information. We noticed that you used to put how much vaccine was allocated to each county on the website, and then that information disappeared, and then information replaced that by what percentage of the county has been vaccinated. And Maui's numbers are very low. And I understand that we have some data entry issues that might explain some of that. But the Lieutenant Governor earlier this week offhandedly mentioned that Maui's getting 10% of the vaccine allocation based on population, but Maui County has 11.7% of our population. And if we rounded to 12 instead of rounding down to 10, that's a difference of 20%. And since Maui is shouldering a burden that's higher by population of travelers, I think we would benefit greatly by a better allocation of vaccine so that we can prevent transmission in our community with our burden of travelers that are coming. Also, I'm interested in knowing if Longs will consider Lahaina and Kihei based on their proximity to tourist destinations as well for opening for vaccine distribution.
I can take a stab at answering that. I've looked at the Maui numbers pretty carefully over the past week. So several things going on there. I'm going to answer your last one first, just because I'll forget it otherwise. So the federal government is making the determination of which long stores are being added to the list based on a formula that they're using that looks at, I think it was the social, I'm blanking on the name. It's this something index.
Social vulnerability index.
Thank you. Social vulnerability index. So they factor in different things like age and illness and comorbidities, and then they're making the determination, not us. We've asked if we could, have a say in it or shuffle it around or anything, and for now we can't. So my hope is that as they add more stores, that'll become less of an issue for us. With regard to Maui's numbers, so we were looking at it to figure out, it's lower than some of the other counties, and so we're looking at it, trying to figure it out. Maui has gotten a significant amount of vaccine that's a little bit less than the population. We base the allocation each week. We work with the Healthcare Association, and they are talking to the CEOs of the hospitals, and so they're figuring out that piece on how much goes to each of the hospitals. And then on our end, we're looking at the counties, and we're talking to our community partners and whatnot, saying, how much do you want? How much can you use? We're making sure that it's not sitting in a freezer somewhere, that they're actually administering it. And then we're allocating the vaccine based on that. There were some challenges in the data at first. And so we weren't sure if it was sitting in freezers or if it was getting into people. From the Department of Health side, we sent a couple of people to help with data entry and to help educate on how to use the VAM system and get the data in. My understanding is that they pretty well caught up right now, and it's maybe a 1 day difference in, in the lag in getting it in. But it also has to do with the providers all making sure that they're reporting and getting their information in so that it can be entered into VAMs. What we discovered was that there was a fair amount of vaccine at the hospital, and I think it really was a strategy issue where the hospital is being very, very careful to make sure that they had enough vaccine for second dose. And so we've had some conversations and we've kind of readjusted the strategy. And so they will be getting out significant amount of vaccine in the next couple of weeks. And the reason that it won't work for them to just administer, for example, 8,000 doses in the next few days, is that then when you look 3 weeks from now, we wouldn't be able to give Maui 8,000 doses to cover those second doses. And so what they're going to do is they're going to administer, I believe the plan was for 600 doses a day, 5 days a week, next week. So that'll be 3,000 doses. And then the following week to ramp it up to 12-hour-a-day clinics to give 800 doses a day, 5 days a week. So that'll be 4,000 doses. And so by the end of next week, 2 weeks, that'll be 7,000 doses in. We're continuing to give them new vaccine. And so they will be able to cover second doses as well as get that vaccine out there. And I think that will help greatly. The other thing is when you look at just percentage numbers, it can make a big difference, like 1,000 doses, because the total, when N is very small, a small number will make it very widely. So I think that's why I was saying, if you look at the amount of vaccine that was administered, that might be a little bit more of a steady number. But we've readjusted the strategy. We're working with the district health office. There's a whole bunch of partners out there. And the other thing that I discovered for Maui, I think some of the numbers were a little bit lower, if you will, and I don't mean that in a bad way, but Maui was being very, very tailored to make sure that those most at need were getting vaccine. So they are doing mobile clinics and going to places that had really high risk populations and elders that couldn't access the pods, and they were making sure that they got vaccinated. So the number for that day wasn't that high because you can't administer as many as you would if it was a drive-through pod kind of thing. And so I think that affected the numbers as well. And so we had some discussions on that, and they are going to restart more of the larger pods and the drive-throughs. And they've got other partners that can take care of the smaller pods to make sure that those who really need the tailored response will still be able to get vaccine. So it's just going on many different fronts at once. And I think now that that's stabilized, I think you will see significantly more vaccine being administered on Maui, as well as we're aware on our side. And so we're trying to get extra doses to Maui to get it out to people. Sorry for such a long-winded answer.
We would really appreciate a more robust distribution and execution on Maui. Is Dr. Peng going to resume the drive-through at the college with the Moderna vaccine now that we receive more Moderna?
That's my understanding, is that they're, Kathy and Sarah, feel free to jump in, but that's my understanding. They're going to resume drive-throughs, as well as now they have partners set up that will do mobile clinics, so they don't have to do that, as well as they have they're working with pharmacies to be able to go into homes and administer, as well as the Kahului Federal Retail Pharmacy Program. So there's a whole bunch of different ways now, and I think that's going to be some good synergy.
They're also opening up a clinic in Kihei.
Yes.
Yeah, we're aware of that. But we would also like to see this information shared, the details breakdown on Island on your website, so that people are able to get more information. We're getting very Oahu centric or statewide centric numbers, and it doesn't help people be reassured if they don't get the island specific or at least county specific numbers. That would be so helpful.
Okay, yeah, and actually if you look at Lanai and Molokai, they've actually gotten a higher allotment of vaccine than their population. And so when you look at Maui County as a whole, it evens out a little bit, but yeah, we'll see if we can get that data out, and I will try and get it to you additionally.
Thank you very much. I appreciate it. And I have one question for Dr. Kimball. The other day in our briefing,
Representative Wildberger, let's give the Senate a chance and then we can come back.
Okay, thank you.
Thank you.
Senator Favela, please go ahead.
Yeah, my question is, now that everybody's getting the second shot, what does it, for the traveling for neighbor islands, how is that gonna work out now going forward? Like when you go to, especially the big island, where you gotta take the pre-COVID test for pre-travel. How is that gonna work out, do you know?
So there's been a lot of question about using it, having some sort of vaccine passport or something that we can use for travel. And right now, the Safe Travel Program does not allow for an exemption related to vaccination just yet. We're definitely looking at it. We're evaluating the data regularly, trying to see when we can do that. There's a medical advisory that allows for you not having to quarantine if you meet all three conditions, and that's being fully vaccinated, that's having no symptoms, and this all has to do with medical side if you get exposed to someone. So if you've been fully vaccinated, you have no symptoms, and your vaccination was completed in the last 90 days, then you don't need to quarantine. So we're thinking, can that be used, for travel as well? I think the biggest difficulty right now the travel program's looking at is how do they validate whether somebody's been vaccinated? So yes, we are looking at it. No, we're not ready to make any exemptions for travel just yet, but they're definitely having discussions and looking at it and trying to figure out how can we validate that somebody's been vaccinated.
Okay, so this card that we have over here for a second shot, that's not gonna do anything. Then when you go into the neighbor islands, then
yeah,
your vaccinated card or record.
Hard though, right? If you can get that and anybody can Xerox it and then just handwritten, like how do you know that the validity of that, right? It makes it a little bit hard to. So they're looking at it though. They're trying to figure out a way to be able to validate.
So I know you said that Ever Beach Lawns, and I was there yesterday when they did their rollout for the vaccine. But a lot of people in the Kapolei, Waianae area, are we planning to do something there for the people on the west side?
So maybe Dr. Kimball can address. There have been a lot of initiatives in the Waianae side. Waianae Comp has actually administered thousands of doses. Sarah wants to speak about the program with schools and what's going on.
Yeah, on the testing front, we've been working with Waianae Coast Comprehensive Health Center on community and school-based testing in that area, especially seeing how those testing strategies can help with school reopening. So that's an ongoing project, and testing is, I believe, starting this week or next.
Thanks.
Okay,
Waianae Comp has been helping to vaccinate the community out there, and educators, and they've been going gangbusters out there. They're doing a really good job in helping the community to get vaccinated.
Thank you very much. Appreciate
Thank you.
Dr. Char, I had a quick question. I was contacted by a constituent earlier this week about a news story regarding vaccination at Kaiser Permanente, where it seems like they went outside of the 1A and 1B tiers, which I think is unfortunate. It's my understanding that this is an isolated incident and that corrective measures have been put in place so that it should not happen again. Is that your understanding as well?
Yeah, thank you. So we get reports every now and then from various entities saying, you know, I heard that this guy was able to get vaccinated or something along those lines, when it's not somebody who's in 1B, you know, they're not 75 and older or first responders or anything like that. So it's hard because sometimes the hospitals are the ones that are allowing that. And so we try and follow up as best we can and really say, you know, work with us, please, because otherwise it just creates chaos and unhappiness, and say, we really need you to be working on this population. We're still in 1B. Please help us target that population. You know, I guess the recourse would be that we just stop giving them vaccine, and that would be really unfortunate. So we're trying our best to work with both the hospital as well as the healthcare association to try and get people to respect the tier that we're in and to allow those people to get vaccinated first. But I really appreciate it when others help follow up on things like that for us.
Thank you very much, Dr. Char. Senator Chair Keo'olole?
Senate members, any questions?
I
have okay, Senator Moriwaki, please go ahead.
I don't know if you covered this, but I appreciate the expansion of all the points of distribution and the distributors. But I was reading that CDC was working with some of the states to have like a website, to have a dashboard where you would have all of these different distribution points and people could sign up. And so you would know where they were in the state. Is something like that happening, or are we moving to something like that?
I think there's a CDC program called the Vaccine Finder.
I think, yeah, that's, yeah.
Yeah, I don't know if Dr. Kemble has more information on that or not. I don't have that much information on it.
Yeah, I'm sorry, I'm not fully briefed on the Vaccine Finder product yet. But we are certainly looking at ways to make scheduling more centralized and easier across the state.
Thank you.
Sounds like something we can follow up on for our 4th vaccine informational briefing at some point in the future. Chair Ichi.
Thank you. House members, if anyone who hasn't asked the first question, otherwise I can go back to Rep Wildberger. Go ahead.
Thank you so much. Dr. Kimball referred to a $500,000 budgeting item to cover, I guess, observation or quarantine or follow-up or contact tracing. Could you detail a little bit better what that $500,000 budget is supposed to cover, please?
Sure. So this was in relation to the hearing on House Bill 1286, I believe. One of the clauses in that bill rolls back the current restriction, which is that you must arrive with a negative test in hand or go through quarantine. What we experienced before that went into effect was a lot of runaround for both Department of Health and DOT and several in the AG's office for those rare but unfortunate persons that really used that as an opportunity to try to test out or hide a positive test it actually had. Or even for those who in good faith, just weren't able to get their result but didn't have a place to quarantine when they got here. So that's actually a fairly intensive process to figure out how to deal with those people and do the communicable disease follow-up side to investigate when there might have been a positive result involved. And so we actually had to staff up during that time period. It was causing quite a headache. So I think if that were to be changed back again, we'd have to plan accordingly for the costs involved. And that those $500,000 for the annual cost would be to fund that staff, that team, to do the follow-up both on the investigation side and to administer isolation and quarantine. Even if people are responsible for their own hotel, for instance, there's still an administrative function to figure out how to place them and the staffing that goes into that.
Thank you very much, chairs. Appreciate it, Dr. Kimball.
Okay, Senate members, any questions? Okay, if not, Dr. Char, I think you've mentioned a number of times in other settings your view on the variants of the disease and their prevalence in the islands, and then the potential effectiveness of the vaccines we have now on the variants. Can you please go over that again for the folks who are watching? I'd also like to note really quickly for the folks who are watching on YouTube that you do work around the corner from the Queens ER. So the ambulances have nothing to do with your building. They have to do with the hospital next door. But if you could talk about the variants, please.
Sure. I'll start in general, and Dr. Kimball is the expert on it. But so anytime you have a virus, and especially with coronaviruses, over time, as they infect more people, they have a chance to have some small mutations in them. And over time, some of those will be persistent. And so what we've seen recently in Hawaii is that we had recognized a couple of variants in Hawaii. Again, I guess from a high level, just what it does is it tells us that we need to be really, really careful and try and limit allowing the vaccine, allowing the virus to infect other people, because it needs to infect other people in order to mutate and then get spread to somebody else. If we can prevent it from getting into anybody, it can't mutate and change and carry on. And so it's just a huge reminder to us that we need to do all those things that we're so sick and tired of hearing, but that really and truly works, and it works well. If you have your mask on and you never come into contact with me, you're not going to get COVID from me, no matter what variant I have, even if it's a really bad one. And so if we wear our masks and we stay away from large gatherings and we keep our distance from each other, we can keep each other safe and we can keep ourselves safe. And I think that's a real take-home message. A press release was done just this morning regarding some of the variants that we found in our community. And I'll let Sarah go into detail on some of those if you wish.
Yeah, so in our most recent results from State Laboratories Division, we have detected a new variant we hadn't previously seen in Hawaii. It's called P2. This is one that is believed to originate from Brazil. Just a single case that we've identified through surveillance. And that case is now out of isolation and close contacts are out of quarantine. But the case had traveled to the US mainland, and that appears to have been the source of that variant. We also have detected a growing number of another variant called B1429 on Maui. And we're beginning to see a pattern where that seems to be becoming a more dominant variant on Maui at this point in time. This is a variant that's been detected in California. It originally detected in Denmark way back in the summer, but it has been growing in proportion in California over the last few months, and now is a dominant variant in many parts of California. And so we're seeing that here too now. So I think one of the question marks is this particular variant is still poorly understood. A lot of the science is still being worked on, but it looks like it might have increased transmissibility compared to some other variants based on how it's spread in California. And so that's the concern, is if it's more transmissible, could it lead to increasing case numbers on Maui and perhaps other parts of the state in the near term? And that really just underscores the race to vaccinate and maintain the mitigation until we really get to that tipping point where we're not seeing spread of either of these new variants or COVID in general.
Thank you, Director Char. I know that you need to leave. If we can, if I can ask a follow-up on the variance issue of Dr. Campbell, and maybe perhaps we do one more round of questions.
I apologize, but I have a 2 o'clock that I commitment with Senator Schatz that I need to jump over to.
Chair, I can stick around for 5 more minutes.
Okay, thank you. So if I can just follow up again, if you can give us some certainty or let us know the level of uncertainty on the effectiveness of the vaccines on these variants. And then I'll yield to the House for one more question.
Okay. So that's been the question for everybody, right? Is if are these vaccines, I'm getting vaccinated now, is it going to be good against the variants? And the answer so far is yes. What we look at is when you get vaccinated and you get that second dose and your body's ramping up your immune system, you create something called neutralizing antibodies, and it's at a level that's very, very high. So even though some of these variants make the vaccine less effective, it's still on order of 1,000 times more than the level that you need. And so yes, you still will be protected, and that's why it's important to get vaccinated now so that these variants aren't transmitted. There are some other variants that really do take apart that antibody response and are quite scary. And thankfully, they're nothing that we have in Hawaii thus far. But that's why we're being so diligent and trying to get people vaccinated quickly, and also really keeping an eye on and doing surveillance to make sure that we're not seeing any of those really bad ones in Hawaii. So the short answer is yes, that the vaccines that we have right now are effective against the strains of COVID that we've seen in Hawaii. And even though some may have a little bit of resistance and may affect the efficacy of the vaccine, the vaccine is still good. Please go ahead and get vaccinated. It will protect you. If you do happen to get COVID and you've been vaccinated, we know that it's not 100%, right? So some people who have been vaccinated are still going to get COVID. The good thing is that it's not of a level where you'll get severe illness or hospitalization or death. That's what we're seeing, is that vaccine protects you from that, even if you happen to get COVID after being vaccinated.
Thank you. Chair Ichiyama.
I want to be respectful of everybody's time, and especially of Director Char. I know that you and your staff are very busy, and I would just like to wrap up by sharing our appreciation for being with us this afternoon. We very much appreciate the information and the presentation that you gave us. It was very helpful and informative, and we look forward to continuing to work with you and continuing the conversation.
And thank you also to you, Chair Ichiyama, and the members of the House for convening this joint briefing with us on the Senate side as well. The slides of the presentation will be made available to the members, and we will try and make those available on the legislative website for the public as well. And for all the members who have follow-up questions that you would like answered from the director, I would ask kindly that you send them to me or to Chair Ichiyama, so that when we do get the answers from the Department of Health, we can distribute them out to everyone else who was watching the briefing. On that note, Director Char, again, thank you very much for being on with us. And I'm going to adjourn the meeting. Aloha.